Hello, I'm Eddie and welcome at the Curse of Knowledge. Yesterday, some Belgian and other European media came out that the World Health Organization warned for an explosive of monkeypox across Europe and that taking action was urgent. It is the way they write about it that concerns me. Warning: explosion on monkeypox across Europe. Urgent action necessary. Just as with previous pandemic, controversial virologists that were at play then are the same now, and we may wonder the odd and ridiculous measurements they will come up with today. Real debatable science has gone off the table, and speculations of only some will probably become the standard again. Last Sunday I posted a video on our other channel about monkeypox vaccines and the Danish company that produces them. I also told that the World Health Organization had an emergency committee on June 23 of 2022. That committee advised the World Health Organization's Director General that the outbreak should not constitute a public health emergency of international concern at that stage. So let's take a moment to see how fear is spread by the media as they blow up official information into misinformation and exaggeration. According to what official and governmental subsidized media wants us to believe is that the European Director of the World Health Organization said last Friday that he wants to reinforce his call to governments and society to take more action in fighting monkeypox, as it is spreading geographically. Urgent and aggregate measures are needed to turn the tide. What does this mean? Who is telling what? And what is told by whom? That is always the question these days, as news is often misused for personal profits or to create fear in citizens to gain control over society. In today's world, both go often hand in hand. When we look at the website of the World Health Organization and read the outcome of the emergency committee that gathered in Geneva on June 23 of 2022, we read following. The committee advised the World Health Organization's Director General that the outbreak should not constitute a public health emergency of international concern at this stage. However, the committee acknowledged the emergency nature of the event and that controlling the further spread of this outbreak requires intense response efforts. And here it comes. This is the game changer for the media to create fear among the global society once again. It comes to mind that some people seems to have the smell of moneypox in their nose and can sniff the smell of profit deep into their brains, no matter the consequences and harm they do to the community. The media tells us that in Europe alone there are more than 4,500 cases, while, as we can see on the official World Health Organization website in a June 27 update, there are in total only 3,413 cases worldwide. The committee advised that the event should be closely monitored and reviewed after a few weeks when additional information about the current unknowns as incubation period, the role of sexual transmission and others become more available to determine if significant changes have occurred that may warrant the reconsideration of their advice. The committee advised the World Health Organization's Director General that member states should collaborate with each other and with the World Health Organization in providing the required assistance through bilateral, regional or multilateral channels and should follow the guidance provided by the organization. The Director General accepted the advice of the committee, adding in a statement that the situation requires collective attention and coordinated action now to stop the further spread by using public health measures including surveillance, contact tracing, isolation and care of patients and ensuring health tools like vaccines and treatments that are available to at-risk populations. The overall risk is assessed as moderate at global level considering this is the first time that cases and clusters are reported concurrently in 5 World Health Organization regions. At the regional level, the risk is considered to be high in the European region due to its report of a geographically widespread outbreak involving several newly affected countries. How the disease is spread and how human-to-human transmission happens is explained in another video of which you can find the link below at the end of this video. In the Director General statement of June 25 of 2022, the Director General said that he is deeply concerned by the spread of monkeypox, which has now been identified in more than 50 countries across 5 regions with 3,000 cases since early May. The Emergency Committee shared serious concerns about the scale and spread of the current outbreak, noted many unknown gaps in current data. A little further in a statement he said, "This is clearly an evolving health threat that his colleagues and himself in the World Health Organization Secretariat are following extremely closely. They call on member states to collaborate, share information and engage with effective communities so that public health safety measures are communicated quickly and effectively." So, the committee has said that more studying is needed the following weeks to understand its development, its spreads and its transmission from human to human before taking improvident actions. The World Health Organization said that healthcare workers that are in close contact with monkeypox patients should protect themselves and that a vaccine is available. For Belgium, the government has ordered 1,250 vaccines for their healthcare workers. When delivery takes place is not known yet. What the major countries of Europe are doing is also mentioned in the video that you can find below at the end of this video. The mainstream media said that the amount of cases in Europe has tripled since last 2 weeks. According to the latest news, a newspaper in Belgium, there are more than 4,500 European cases of monkeypox. In Belgium, 118 cases are known, and in Holland, 288 cases are known. As we know that the European population was estimated at 447 million inhabitants in 2021, that would mean that as much as 0.00001% of the European population is infected. The percentage of infected people in Belgium would be the same percentage, and in Holland it is the exaggerating amount of 0.00002% infected people. I do not want to criticize the importance of actions against the monkeypox disease, but we might even so not finding it normal that the media creates fear among citizens by only giving partial and even misleading news facts just to increase newspaper sales. Please tell me your thoughts in the comments below. If you like this video, then click on the thumbs up button below, and if you want to see new videos in the future, then subscribe to this channel. Thanks for watching.